Well, diabetes is a big concern to our community. It is. Disproportionately affecting African, Americans of all ages. Yes, it is, and that's a major concern. To me, that's why I'm so interested in making sure that the health of um, our African American community, improves. That's why I'm interested in that. Not everyone in our community have access to health education, to health care, the health education that is needed so they can manage their disease well and prevent it from turning into diabetes, and all of its complications. One of our churches, Brown Chapel AME Church, was the first church in North Houston District to get trained in teaching diabetes self-management education course. The very first church, it was the pilot church. I was impressed with what they have done and felt it was necessary for other churches to participate, in this health initiative. So we got 4 other churches interested in joining. I myself am also part of this great effort. I was part of the 6 weeks facilitator course, that was given, and so effectively done. Well, for someone living with diabetes, it was important for me to revisit the concepts I've heard before. I mentioned earlier that I was instructor of nutrition at Prairie View A&M University. About 2 decades ago, it was an opportunity for me to revisit some of the concepts that, I taught well to my students, at that time. It was a refresher course for me. And suddenly you understand the subject matter differently because you want the learner to get the very best, out of the education session. And that's the main goal, to get that person that's listening to that aha moment and say, I got it. I see what I'm doing wrong. I see what I need to do to improve my health. And that's what, and that's what's so important about this. The course were well structured. The trainer was Grace Serena, is the best of the best. She did a fantastic job. Interaction with over 20 other facilitator trainees, from the different denominations and faith-based, was just awesome. That interaction with persons from other, faith-based communities, native backgrounds and native derivations, and that's what made this effort a beauty. Yes, I am. I am prepared to teach the DSMES in my community. I'm ready to do so. Also, I'm bringing our team together, to facilitate training in all of my district meetings. Every year I have about 3 district meetings where my churches come together and we go over programs, educational opportunities, and so on and so forth. But this would be an awesome opportunity to have the teams come, and to initiate a training program in communities where the church is located that will host my meeting. And we want to do this in a very effective way so that we can leave a lasting impression in that community. Three times a year, every 3 months, 4 times a year, I visit each church in my community in what we call the church conference every year. Every 3 months, 4 times a year, I visit all of my churches. So in these settings, it's a wonderful opportunity to be able to present these efforts so that every church in the Northeastern District will have a buy-in, into this health initiative that we are promoting. There'll be a buy-in in it. I hope that, that across the Northeastern District, with about 20 of our churches, that people with pre-diabetes will learn how to prevent their disease from progressing, and that people with diabetes as well will be much better equipped to manage their disease well, so that they can have a winning strategy, on how to manage diabetes. For people without medical homes, there are people that don't have insurance, people without medical homes. Working with cities changing diabetes will also lead to better access, better support, better education, and ultimately much improved quality of life, even if one lives with diabetes. Access, to cities changing diabetes. What a major resource for our communities, for our churches. Well, best way to protect, oneself from COVID, from diabetes, and the risk, complications from COVID, is one, to manage, our diabetes well. Manage it well. Eat healthy. Engage in exercise regimen. Get vaccinated. Stay current on the boosters. Presently, I've had one of the boosters. I'm waiting to get the second booster. And then know diabetes self-management so that one can get in the driver's seat of one's own health. That's it. I want to recommend that people that are suffering from living with diabetes during COVID, I want to recommend that they don't isolate themselves. Because when you isolate yourself, people can become depressed. High blood pressure can rise. People then tend to indulge in overeating. All of these things, affects one overall health. I recommend that people don't isolate themselves, that they try to exercise, They try to participate in peer support groups, like cities changing diabetes peer support. I want to recommend that very strongly, and then I just want to recommend, that people socialize, but then adhere to the CDC, recommendations so that they can live.